Hello and welcome to the 7 steps to an effective consultation. My name is Dr. Claire Stevens. I'm the founder of Global Vet Solutions. I've been in small animal practice for over a decade and a partner in 3 veterinary clinics in the northern New South Wales region. Nowadays, I work as a coach and a trainer with a focus on leadership and communication and team culture within veterinary practice. I've also written a book. This is my book on the screen here, Love Your Dog. It really came about out of frustration. I didn't have the time in practice to go into the detail on various diseases and canine health and care factors with clients in that 15-20 minute time slot. And I really wanted some good resources for clients, and I set out to find some books, and I just couldn't find a book that covered common canine diseases written by a vet in Australia that was current. And so that's kind of how this idea was born. It's available in all leading bookstores and online across Australia. And if you are interested, if you've had a read and you like the book and you're interested in recommending it to your clients, I can arrange a 40% discount off the recommended retail price for vet practices. So if you just contact myself or Woods Lane Publishing, we can get this book in stock in your clinic. So nowadays I work in training veterinary staff through my business Global Vet Solutions and in partnership with VetCX. So guys, let's get into the 7 steps for the perfect consult. These are 7 techniques or steps you absolutely should be using in your consultations. And no matter how many years of experience you've had, how long you've been in practice, it's always worth refreshing on these things, because even the most skilled and experienced vets develop bad habits and shortcuts when it comes to veterinary consults. So the 7 steps are learning about first impressions, how to empathize, ditching our medical jargon, watching the tone of our voice in consults, summarizing, signposting, and safety netting. Okay, so let's get started with first impressions. So whether we like it or not, people judge us on the first impression. So it's really worth thinking about how we greet our client in the waiting room and those first few minutes in the consultation. So think about your opening line. Are you using the owner's name? Are you using the pet's name? Do you know if the animal is a male or a female? How are you welcoming them in when you call them from the waiting room? Think about your level of enthusiasm on that first impression. Hello, Mrs. Jones. How's little Fluffy today? Or how are you doing, Sandy? Come on in. G'day, Banjo. These are really welcoming opening lines that can set your consult off onto the right foot. Also think about your body language. What is that telling the client? Are you visibly stressed or tired? Are you hunched over and mumbling, looking at your computer as they walk in? Or are you smiling, showing openness and warmth? These first moments in the consult are really about connection and about active listening. And that means giving your client the space to speak without interrupting them. And when I talk about active listening, I don't just mean sitting there like a potato. You really need to be engaging as you're listening. So nodding your head, smiling, if that's appropriate, or having a concerned frown if that's appropriate, and demonstrating that you're listening and you're interested as you take down the history and listen to the client's story. Number 2 is empathy. Now, great customer care or client care starts when we put ourselves in the client's shoes. So understanding that, hey, they have busy lives. Money might be tight for them, especially at times like this. But even so, they really almost always want what's best for their pet. And that's why they're there in a consult with you there and then. So showing clients empathy does require you to expose a degree of vulnerability, but that's really how we create connection, how we build rapport and trust. And there are two ways you can demonstrate empathy. That can be verbal, where you are acknowledging their suffering and using comforting words. You know, something like, gee, Sandy, it must have been awful to see Fluffy being attacked by that dog today, especially in front of the kids. That's a that's acknowledging suffering and offering empathy verbally. You could also use non-verbal empathy. That's a concerned frown, a nod, a kind smile, or a hand on their shoulder. So we should be empathetic in all of our interactions with our clients. Number 3 is summarizing. Summarizing is really important in the consult because it shows, firstly, that you've listened. It checks that you've interpreted the history correctly, but also it gives the owner the chance to correct you if you've got something wrong or they've told you something that's not quite right. I like to use this technique after getting the history just to clarify the key points, and also at the end of the consultation, you know, just summarizing what I found today and the key take home message in terms of the treatment plan. Uh, it's also really a great way to check back in with your clients. So, you know, I've just given some examples here. You could say, oh, look, thank you for that. So can I just check that I've got this right? And then you can, you know, summarize the main points of the client's story. Or you might say, okay, so there were 3 main issues today, X, Y, and Z. And what we're going to do for our treatment plan is ABC. Okay, so you're just creating a really short statement that wraps up the findings, all the owner's concerns, and the treatment plan. So summarizing is a really great way to communicate. And then we've got signposting. You know, we've got to remember that the vet clinic is such familiar territory to us. We basically live there, let's be honest. So we know exactly how it works. We know the routine of a consultation, what's going to happen, you know, particularly if it's diagnostics or hospitalization, a discharge. We know exactly how it's all going to pan out. But it can be really alien territory to our clients. And so with no map or with no signposts, our clients obviously feel lost and confused. They're nervous or distressed. You know, so we have to be empathetic again to those feelings. And a great way to do that is to put yourself in their shoes. And a way I put myself in clients' shoes in terms of signposting is think about when I go to the mechanic or a computer store like Apple or the accountant. I'm not great with spreadsheets and numbers and tax. I don't really like computers. I mean, in terms of all their features and functionality. And certainly engines are not an area of interest of mine. So when I go to these professionals, I'm a bit out of my depth too. So I appreciate when those professionals signpost and explain things clearly to me. And so we can do that for our veterinary clients. So a signpost is an explicit statement used to inform the client what you're about to do, what you're about to say. So if there's an example of a client rushing into treatment questions in the first couple of minutes of a consult and they weren't really sure on the consultation process, you could say a signposting statement like, well, first we'll talk about Sammy's itching, then I'll examine him, and later we'll talk about ways we can treat the problem. So you just specifically stating the stages of how you will do things today. Or another example is if you're in a consult and you feel like there needs to be a discussion around euthanasia or the animal's quality of life, rather than rush into that and be too abrupt, you could say, I'd like to ask some questions today about Lulu's quality of life at home, if that's okay. Okay, so that's a nice signposting statement that will lead them into this unknown territory. Number 5 is ditch the medical jargon and chunk and check. We vets tend to look at hard science to make our decisions. It's how our brains work. It's how we've been trained. But not everyone finds science as compelling as we do. And so speaking in textbook terminology all the time can actually alienate our clients and create barriers between us. So when you give your information, you want to do so trying to avoid too much medical language and to give it in bite-sized chunks where you can check in that they're understanding it. So you might say, look, I'm sorry to bombard you with all this, Julie. I know it's a lot to take in. Do you have any questions so far? And this is a really great way to support clients in surgery discharges because they are consults where you're presenting a lot of detailed medical information to the client, about the surgery, about post-operative concerns, about various medications. So use these questions then. Is that making sense? Am I explaining this okay, John? Please stop me and ask me any questions if what I'm saying is not clear at all. Okay, so it's just giving the owner permission to clarify things, slow you down, and respecting that they don't want tons of medical jargon in that consultation. And number 6 is what's your tonality. This is really interesting studies done in human medicine that found that surgeons who had a high degree of dominance in their tone of voice were more likely to be sued than surgeons with a voice of low dominance. And that's really interesting to me because we know that communicating effectively is not so much about what you say, but how you say it. And tonality is such an important part of the way we communicate. Nobody likes a know-it-all. And we have to be really, conscious to be kind and gentle and respectful when we communicate, even on the busiest and most stressful days in practice. And number 7, the last one, is safety netting. Guys, uncertainty is a constant in medicine, so we really must prepare for the unexpected. So safety netting is communicating the possible outcomes to the owner at the end of the consult. And to do this effectively, you've got to ask yourself 3 questions. If I'm right, what do I expect to happen next? How will I know if I'm wrong? And what would I do then? Okay, and then you want to make a safety netting statement, including that information to your client. So if we're right today, Sandy, I'd expect the antibiotics to start taking effect in the next couple of days. But if Fluffy's not improving and you're seeing XYZ, in that case, I'd love to see you back for more diagnostics, a recheck, or whatever it is that you'd like to do next. So we should always be making a safety netting statement of some description to our outpatients or sick patients that are going home. Okie dokie. So guys, if this is of interest to you and you've enjoyed this refresher webinar today, I'd like to give a little gift to you before finishing up today. I really recommend that if this is up your alley, that you complete the Perfect Consultation course, which I've created. It's a 15-hour course. It's AVA approved and available online. It's a CPD program with Vet Ed points, so you get 15 CPD points, and it's designed to tackle the most common challenges vets face in communicating with clients in the consult room. Things like dealing with cost restraints, explaining difficult medical concepts to clients, delivering bad news, and managing time restraints, because we all know what it's like to be fully booked, even double booked. So it's really for vets who want to take their consulting skills to the next level, people who want better results in their career, and also vets who want to connect with clients and get more fulfillment out of their jobs. And not only that, we also see improved clinical and business outcomes. So if you are interested and you'd like to learn more, you can you can register and find out more at my website, globalvetsolutions.com.au, or my business partner's website at vetcx.com.au. Now, for your Prezi, let me just put a little video on for you. For those of you that are interested, I've got a discount code for you at the end. Congratulations in taking the first step to running smooth, enjoyable, and productive veterinary consultations. This is about developing skills that you weren't taught at vet school, skills that will escalate your career and have you seeing better results as a clinician. Having been a small animal veterinarian myself for over a decade and being a partner in 3 separate practices, I have learned that all the veterinary knowledge in the world is simply not enough to be successful in practice. Okay, guys, so if you're interested in that course, I'd love to gift you 30% off today. All you have to do is go to one of our websites at the checkout, put in the code VetExpo30 for your 30% off. So screenshot that slide if you haven't already. This offer is valid until the 15th of November. Thank you so much for listening. Good luck in your consultations, and I hope those 7 tips will help you. Okay, enjoy the rest of Vet Expo. Bye, guys.